BC's top doctor has called for the urgent decriminalization of illicit drug possession. Provincial Health Officer Dr. Bonnie Henry feels if people are less worried about being caught with drugs, they are more likely to call for help during an overdose.
I hear from people, and I've heard from families, I've heard from people who use drugs, that some of the issues that they are dealing with around stigma and shame is because of the idea that if you use drugs, you're a criminal.
Dr. Henry presented her nearly 50-page report Wednesday, suggesting the focus should be on helping people with their addiction and not on criminal prosecution.
They're afraid of losing their family, of having a criminal record, of being put in jail, of that whole idea that you can't even help somebody or else you're tarred with that same sort of idea that it's wrong and bad and you're a criminal.
Although drug laws are federal, Dr. Henry says there are ways to work around them provincially. In the report, she suggests a couple of options. One advises the Solicitor General to use the Police Act and guide law enforcement to link people to health and social services. So someone possessing a small amount of illegal substance could face an administrative penalty rather than a criminal charge. But that's not something the minister is willing to do.
It's not appropriate for me as minister to be directing police in how they conduct their operations. What we need to assure is that people are able to get the health and the help and the treatment that they need. That's why we're making the significant investments in mental health, housing, poverty reduction, all of those things that are part of the complex solution that's required to dealing with the opioid crisis that we face. There's no silver bullet.
Meanwhile, the federal Minister of Health has announced just over $15 million will be invested in new initiatives to combat BC's opioid crisis.
The tainted blood supply, drug supply, is really the issue at this point in time, and that is why that we are making investments in different types of projects, research projects, to make sure that we can get the proper data in order to see what we can do, to further move on to make sure that people have access to a clean supply.
According to Dr. Henry's report, 3,700 British Columbians have died from a preventable overdose since the province declared the opioid crisis a public health emergency just over 3 years ago.
We know that we have probably upwards of 100,000 people right now in British Columbia who have addictions and substance use disorder. Not all of them are to opioids, but we need to have those off-ramps for police for dealing with those, and we need to build the health and mental health and substance use and social supports to get people on that road where recovery is a possibility.
In Vancouver, Ashley Burr, City News.